Welcome to the Doctoring Differently podcast. I'm Dr. Naomi Lawrence-Reid, your host, a pediatrician, and creator of Doctoring Differently. I teach physicians how to explore flexible, lucrative, and exciting careers beyond full-time clinical medicine. Today, I'm joined by Dr. Connie Gomez Orem, a family medicine physician in Southern California who, after 10 years of full-time practice, has pivoted to a variety of other exciting physician opportunities. Dr. Gomez attended UC Irvine School of Medicine and Kaiser Permanente Family Medicine Residency Program. I'm so excited about Dr. Gomez and all of the guests on the podcast who are creating their own paths in medicine. Subscribe to the podcast on Spotify, Apple Podcasts, or wherever you get your podcast. And subscribe to the Doctoring Differently YouTube channel to watch all of the episodes on YouTube. And now for my conversation with Dr. Connie Gomez Orem. Welcome to the podcast. Happy to have you here.
Thank you so much for having me. I'm really excited to be here.
You are so welcome. And the way that you and I met, I will get into in just a little bit, but you used to be my primary care physician. And so that is why talking with you and watching your journey is always one of the most gratifying things, albeit even though it left me briefly without a primary care physician, I was so happy to watch you explore a lot of different types of medicine. So I'm going to go back to shortly before our paths crossed in 2021. You were a full-time family medicine physician at a large HMO in Southern California. But I think by the time you and I met, it was safe to say that you were maybe looking for a change or not as happy as you used to be in your position. Can you describe what was going on in your life and in your career at that time?
Yes, definitely. You're right about all of that. So around that time, it was a little bit after COVID had begun. I had a toddler at home. And as you mentioned, I was working full-time, which was about 4 full days of patient care. And then 1 day off, but was still considered full-time because you still had to do your in-basket. And so that included, of course, going through, messages, emails, lab results, things like that. And even on my supposed day off from patients, I was still required to do that. So it was a lot of work. And so I always wanted to make sure, I always made it a point to finish all of the work that I could there before I went home, because I just didn't want to bring it home with me. And over time, that just kind of became a little bit more draining, and I wanted to be able to make my own schedule.
Sure. I think that resonates with probably all of our listeners, whether they're residents, whether they're attendings, early, mid, late career, want to finish work before we go home. Okay, so you'd been in this position for 10 years, had a toddler, but even that, 4 days a week seeing patients, we know that turns into staying in the office way too long, or for some, bringing charts home. So what was keeping you? It sounds like you were kind of looking around, or maybe not looking and thinking, is this my life now? Is just this going to be my career? What were you thinking?
I definitely suffered from that arrival fallacy that I think a lot of us do, where, going through school, you think like, when I get to the next step, that's when I'll, I feel like I made it. I'm good. I'll be happy there. And, I got to that point. I was an attending and practicing for a long time in family medicine. And I had everything that I had planned to do. So I kept kind of waiting around for like, okay, what's next? And it was paid very well. The benefits, healthcare benefits, retirement plans were amazing. And since I had a toddler at home, my husband was a stay-at-home dad, so I was responsible for all the finances. And so that put a lot of pressure on me to make sure that I focused on that. And so really looking into other alternatives, even though that was something that I would want to do at the time, it really wasn't anything that I thought was really possible, or I didn't even know how to go about doing it.
Okay. All right. Well, now I'll segue into our meeting. And now this is, we're getting to around the spring of 2021. We are over a year into the pandemic. I had begun thinking about Doctoring Differently, about creating this platform. I myself had begun my own journey out of full-time clinical medicine in 2017. I was, of course, a little apprehensive at the beginning of the pandemic, thinking, what does life look like for me out here? I feel like I was, quote unquote, like skirting the fringes of a quote unquote real doctor job. Turns out any doctor job is a real doctor job. But I did not know what the pandemic would do for my per diem and my locums and some aesthetics and some other things that I was doing. And it turns out I was thriving. And I wanted to be able to, other than just call and bug my colleagues and friends, I thought let me develop a curriculum. I think this could work if it's working for me and I'm making money and I'm happy and I'm flexible, and it should work for other doctors. And as I put together the curriculum, part of near the end, I tell doctors to get a primary care physician. Mm-hmm. And go see a doctor. And as I was writing this, I looked in the mirror and felt like a big hypocrite because I myself had not been to the doctor in 7 years. We prescribe our own antibiotics and this, that, and we diagnose ourselves and we keep it moving. And so I said, you know what, self, you can't tell other doctors to do it if you're not doing it yourself. I went on the website. I found a nice female physician with kind eyes. That was my only criteria. I saw your picture and I said, her. I went to my appointment. I sat on the table. You did not know me, of course. You did not know anything about me. And I knew that. But you walked in, and I will say you looked exhausted and so tired. And I heard all the hoopla going on in the clinic. And as you sat down in front of me, I thought, maybe she could use me, and maybe the things that I've learned along the way she could use as well. I think blurted out during your quick social questioning about what I do. I blurted out this new thing I was working on, and long story short, you ended up being the very first person to sign up for the Doctoring Differently course, and that was in August of 2021. So, what made you sign up for the course?
Well, I think a little bit what we were mentioning before, where I was in this, great job, but then there were those like golden handcuffs.
Sure.
Where there was so much more that I wanted to do. I just didn't know how to do it. But then all of a sudden, here you were. You showed up. It's right. Like it had to be like that perfect moment, I think, where the opportunity came up where here is someone who actually knows how to do this, has done this before, and can help me. And so, yeah, there's no other time, I think, in our training where you really get a chance to explore other things, or they don't really tell you anything about other options other than kind of like the regular, residency programs. And so there's so many different things that we can do in medicine that we just don't know about because we just kind of go through, the regular like run mill of everything in medicine. So I knew that this was it. This was my sign. This was my chance.
Okay. It was very serendipitous. I tell the story all the time, how it happened. I truly wanted to quote unquote test my theory on someone or on a group of physicians. I just knew that if it could work for me, it could, other physicians could benefit from at least being exposed to the options. And at the time, I only knew a couple of them. I learned so many more now, but you're absolutely right. Physicians, we are not taught, as you said. I think there is not just not taught. I think that we're discouraged from that exploration that you've described. I think that we are, it's and again, I've talked about on this podcast our attendings and the people, our mentors. They themselves have never explored it or experienced it, so they have no place to give actually fair, assessments and advice. They often tell us, don't even try. They don't think it's possible. And we kind of keep that cycle going. Okay. So I remember during our live courses, this is when I taught the course live on Zoom every Tuesday at 6 p.m. And of the physicians in that cohort, you were the only one still in the office every time. And I thought to myself, I don't know if Dr. Connie is if she's gonna make the change. I get it. She probably just finished seeing patients. She's about to do some write some notes. But I know the grasp that these organizations have on their physicians. And, as you described, just the weight of having be responsible for your family's income and insurance. So where was it that you decided or thought, you know what, maybe I can do this. Maybe there is something for me outside of this position?
I think the day that we met for your appointment, I thought, okay, there's definitely a chance that I could do this. I always wanted to do it. I would think about, okay, I just have to do this for like 15 to 20 more years and then I can retire. And I would tell myself, but I don't really want to.
Mm-hmm, right.
I want to do things differently with my life.
Yeah.
I want to do medicine differently. And so that was kind of what helped me. And then being in the course, I got to see how other students also, they had already like resigned. They had already been looking into new jobs and things. And yes, I was pretty much still, in the grind.
Yeah.
But because of, what I've mentioned before, I was
Sure.
really nervous to, make such a big change. And I was very
course.
cautious. And I think a lot of us in medicine are like that. We're like very like risk averse. We
Yep.
don't like to take a lot of chances.
Mm-hmm.
And so when things are going well, why should we rock the boat, right?
That's true.
Yeah.
It's
But
true.
if you don't try, you never know.
That's right. That's right. I like to say if we can't see the sand at the bottom, or, if we can't swim, we're not going to rock the boat. But if we know we have options, if we can see the shore, if we know we can stand up in the water, then maybe we will. Okay. So the course ended, if we go back, September of 2021, what were your thoughts around that? Like, what were you thinking you could do next, or how were you evaluating your situation?
So I was definitely doing all of my homework. So
There
they
is
give us a
homework in
lot
the course. There's a little bit of homework.
There is a little bit of homework, but it was good homework.
Yeah.
I mean, a lot of it was really interesting things that I had never done before. And one of the things that I think like really kind of cemented it for me that like I'm really doing this and it was a really meaningful thing was getting a white lab coat that was just for me, just with my name on it. There was no like hospital or affiliation, no other organization affiliated with it. And it was just like for me, like, oh, I can do this. I am a physician and I can do this the way that I want to do it. And so that was kind of the big part of the homework that I think really helped me kind of move on, just getting those coats and then doing everything else. And I just eventually got brave enough with all of your support, of course, to go ahead and, turn in that resignation letter.
That's great. Thank you. That is one of the first assignments in the course. So some of the homework can be a little bit fun. But yes, one of the assignments is getting your own white coat. We are given white coats in residency and med school that have our med school's name or our institution's name on it. You are stamped, you are branded as affiliated with those institutions. But that is such a important step of just like, no, this is mine, this is me. I am still a doctor outside of an institution, and maybe that's an important mental step for all of us. Okay, so I remember very clearly getting a letter in the mail. Now we're into the early winter of 2021, and that letter said that Dr. Connie Gomez Orem would no longer be my PCP. And I will say I took that as my own personal diploma. I feel like you were my proof of concept that, again, just showing the light, just exposing doctors to different things. Okay, so you resigned, and I was temporarily without a primary care physician, but I did it to myself, and I'm proud of it.
I'm sorry.
So
and let me tell you, there was a lot of guilt, affiliated with that. And I think as primary care docs, that's a big thing.
Yes, touch on that.
Yeah, because most of our, I think, education, we're kind of taught to always focus on the patient, and we just really leave all our self-care behind. And it just becomes more and more apparent as time goes on. And so that was something that I got to the point where I realized that was something that had to change. And I had built these like amazing, long standing relationships with so many patients. But at the same time, I also had to take care of myself because I'd be a lot better physician for my
That's right.
patients if I could do that.
That's right. That's right. If I could ask and just go back a second, how did your colleagues, your bosses, how did they handle your resignation?
I actually kept it kind of a secret because I didn't want anyone to really know too much in advance. It was something that I had thought about doing for some time. And so I was getting everything ready. As I mentioned, I wanted to kind of get my ducks in a row before I actually resigned. So I was making sure that, I was doing all the homework, getting things lined up, looking for jobs, just doing all the different things that I could do
Mm-hmm.
to get out there. But they were very much surprised and shocked by it. And a lot of them were trying to kind of like my close colleagues were trying to get me to stay. Um, but then, I mean, to be honest, a lot of them afterwards wanted to know what I was doing and why I was doing it and how I was doing it.
Mm-hmm.
So,
Mm-hmm. Okay. Okay.
yeah.
I tell, the story how my boss told me I was making the worst decision of my career. I hope
Yes.
you and I hope most physicians don't get that feedback. That can be very discouraging early in the journey. But my boss, when I told her, this was the last of many conversations we had had where I tried to make my position work and I tried to change my schedule or get more clarity or maybe get a
Hmm.
different title or different responsibilities. And nothing was working. I was still very unhappy. And when finally we had that conversation where I said I was resigning, I was told I was, making the worst decision and I'd be back in a year and that was the best job I'd ever have. And I always tell physicians, yeah, you may not get the glowing, the cheers, you may not get a goodbye party, you may not get a cake. Those seem
Yeah, none
reserved
of
for
those.
people. No, those I will say, interestingly, the only people or the only physicians I've seen get those cakes are the ones who are like having to be taken away by a spouse's job and they're moving to another part of the
Oh,
country. Those seem to be the
yeah.
people that get the goodbye cakes. I'm not bitter. It's an observation that people who are just going to another job or doing something else, there's never that kind of celebratory nature
Yes.
around resigning. Okay,
Yes.
but then you mentioned you're also feeling some guilt around primary care. And I think some people also
Yeah.
feel like, well, I can't leave my colleagues, there'll be more work for them
Absolutely.
if
And
I leave, and we're already understaffed. How did that feel?
absolutely.
Did you negotiate that?
That felt terrible.
Mm,
That because for example, you got that letter in the mail, which meant that, you would be assigned to some of my colleagues.
mm-hmm.
And so,
Yeah,
it's
it's tough.
it's tough. It's definitely tough.
Right. As residents, I think we early are given, we feel like a team. I hate the
Yeah.
word, but a family, right? Like, no, if
Yeah.
I'm sick and I've got a fever and the flu, but if I call out sick, then, my other overworked, underpaid, maybe sick themselves, colleague will have to step in for me. So, we
Exactly.
push that down and we plow through despite our own illness,
Yes.
discomfort, burnout. So we have to
Yes.
push through the guilt of quote unquote leaving patients. But again, this is not your practice. This is, you're not responsible for the staffing. It sounds as if I remember, your department was a little
Hmm.
overstaffed. Was that you? Like they weren't hiring, they weren't bringing on help to ease the load.
Yeah.
Okay, so
Yeah.
what was your next best step? Big fan of a next best step. What did you do?
So my next best step was locums.
Okay.
I liked that idea because I was really kind of taking a place of another physician while they weren't there.
Mm,
And so I wasn't kind of going to be in the same position as a PCP where I maybe would have that same responsibility in that in basket. And so that was
the in
very appealing
basket.
to me. Yeah,
Good. Okay. Okay, the in
And
basket. Oh man, big. I
yeah,
am not a fan of the in basket. Okay, so
no,
I talk in the course about locums, right? We all
yeah.
somehow they get our numbers, they start calling, they start
Oh,
emailing,
yeah.
and we we don't answer. We ignore it all because if we we A, don't want to engage, and B, if we think we do, then suddenly we are committed to do a 3 month stint somewhere far away from where we live. So how did those first conversations with a recruiter or agent go?
They were interesting, and some of them were eye-opening too.
Okay, okay, tell me.
Um, One of the things that you teach us about in the course is negotiating.
You're right.
And that was something that I was not used to at all.
Mm-hmm.
Um, I'd have to say now I know there's a lot more talk around the contracts that we're signing and really looking at them
That's
carefully and,
right.
those non-compete clauses and things like that. Um, but so this was the first time I was actually looking at contracts, actually kind of discussing how much my salary would be or,
Mm-hmm.
stuff like that, that I never really, you never felt like you had a say in it.
Right.
And so it was very interesting. And then some of those recruiters, they can be really intimidating.
Mm-hmm.
And they kind of tell you like, well, no, this is all that you're going to get.
Mm-hmm.
And that's not true. The more you look around, you
No,
can find, better pay, better location. Sometimes
that's
they'll
right.
pay for your housing, they'll pay for your airfare if you
That's right.
travel, they'll pay for so many different things, your malpractice insurance. And so it's all about kind of like looking into everything so
Mm-hmm.
that you can find the right match for yourself.
That's right.
And so that's what I ended up I was fortunate to find. It was funny that you said a 3 month stint because that since I had never done locums before,
Mm.
I said, let me try 3 months to see how I like
Okay.
it.
Yes.
And in a
Yes.
lot of places, maybe that they won't let you do that. They want to do 6 months or they want a year contract.
Right.
So it was nice that they let me do 3 months
Mm.
and then I could test it out. And it
That's
was
right.
Monday through Friday. There was no call. It was 6 to 2. And it was nice. It was a really good schedule.
Great.
Yeah, and it paid really well. And so I actually ended up doing better than I would have if I would have stayed at my previous job. And then the nice thing about it was that I was able to then take a few months off. So I
Great.
took like 4 or 5 months off after that. And that
Ah,
was really nice because I had never been able to do that before.
sure.
And so I was taking some time to really take time off and be there with my family.
Great, great. You've said so many of my favorite things. I love the flexibility and the time that you were able to have. But, it sounds like you got through at least going back to the locums part, at least having those conversations, having some of those difficult for us conversations, right? We're not used to
Oh,
talking about money.
yes.
We're actually actively told, as you said, this is a non-negotiable contract. This is a non-negotiable
Right.
salary, which just take a step back. That is an absolutely wild thing to say to some of the most educated professionals, important members of our society. But healthcare is a business, and a smart
Mhm.
business person will tell, the workforce to not negotiate, all of those things. So very proud of you for doing that. And as you said as well,
Yeah.
it can be eternally flexible. It can be what you want, where you want, in the state you want, and it will take repeated conversations sometimes with a few different recruiters. But I'm
Yes.
glad you said one of my favorite words, and that is try. You just tried
Try.
it. I will tell you that is a near curse word to many physicians because we don't try. We do,
We
we learn,
do.
we do, we succeed. We learn, we do, we
Yes.
succeed. That is it. There is no room
There is
for
no.
just trying. Trying implies that you're not an expert, and trying implies you may fail. And we don't have
Right.
a high tolerance for the prospect of failure or embarrassment, which is why we don't attempt to negotiate, often because we've been told not to, but also
Right.
we something like trying a new job sounds very
It's
not
like
concrete.
wishy-washy.
Wish
Yeah,
you
especially for
exactly.
medicine, for
Exactly,
the
especially
medical
for
field.
medicine when you finish your training, your residency, your fellowship, and then it's a full-time position and you're either on an academic track or a private practice partnership track. You're on a track, right? A track. It's very rigid. It's straight. And often you're not the one steering it, unfortunately. But here in this world, I don't know, that analogy just kind of came to me. But here we are. I love a good analogy. Anyway, so you did that, though. So you tried, and you tried a locums assignment, with a young child and with, the responsibility of insurance. I think you were able to find your own benefits. That was a concern.
Yes, definitely. So that was one thing where I could, look up and I'm in California. In California, we have, the marketplace. So you can just look that up. No problem. You can choose exactly what kind of plan you want. Or you can continue like with Cobra coverage. So that wasn't really an issue. And it's just so nice to be able to have that option.
That's right.
That wasn't something that was going to tie me to maybe somewhere where I didn't want to be anymore because I wanted to try different things.
Exactly.
Yeah.
I mean, it is amazing. I say the fear of not having benefits keeps good doctors in bad jobs all of the time. And that is often, one of the more major things rather than, okay, I can explore. I think there is more discussion about travel doctor work, locums, but it's the benefits, right? It's no one ever taught us. So we must not be able to learn or to know, or it must not be legitimate, or I'll be deep in healthcare debt if I, step out of the coverage plan that my employer has delegated for us. But I think all of our fears are just based on the unknown and not being taught. Okay. Well,
Absolutely.
Again, great time for a short break. When we're back, more with Dr. Connie Gomez Orem. This episode is brought to you by Foster Crown, a highly rated boutique physician and executive search firm. A first of its kind, Foster Crown facilitates both permanent and independent contractor placements nationwide with specialization in physician representation. Having a physician's first agenda, they can assist in orchestrating a hospital or private practice business relationship. This includes all contract negotiations, compensation, malpractice insurance, credentialing, and invoicing. Let Foster Crown handle the particulars so you can focus on patient care without the burden of administrative tasks. Visit fostercrown.com today to help discuss your career goals and how they can help you achieve them. We're back with Dr. Connie Gomez Orem, my former PCP and one of the first student to take the Doctoring Differently course, who is now 3 years from full-time clinical medicine as a family medicine physician, and was describing a really good life that kind of started almost immediately after. So it didn't sound like you needed a whole lot of time. It didn't seem like your runway was that long to making the income or replacing the income you had as a full-time family physician. Is that true?
No, that's true. And mostly that was me because I was so nervous about there being a big gap in time.
Sure.
And so I just made sure I had my little like locum set up right after that.
Right.
But then once I did that, it really gave me the confidence to feel like, I can do this. Like Dr. Naomi is right. There's no way that, I can't succeed. This is going to be great and I can do whatever I want. And so I think what I learned from that is that we were talking about non-negotiables earlier. Well, I decided that I have my own non-negotiables.
Okay.
Right. So my non-negotiables, I don't want to take call. I don't want to work on the weekends.
Right.
And I don't want to have to ever go home to do an in-basket.
Yes.
And so I just started kind of coming up with what I wanted and making it so that I can actually design my medical career the way I wanted to do it instead of other people telling me how I should be doing it, which is kind of what we're all told from the beginning, that this is the way things are and this is the way you have to do it.
That's right. And we also think that we need a stack of savings, right? That to be able to leave. Yes. I talk to so many physicians who think, okay, when I've got, 20,000, 30,000, 50, 100 in the bank, that's when I will feel good about leaving clinical medicine or full-time clinical medicine. I think you still do clinical medicine, as do I. So you're not leaving clinical medicine, but there are ways to do it on our terms. what would you say to a physician who says, I can't make the move yet. I need everything to fall into place first?
So I would probably be one of those people before your course, which is why I was stagnant and I never got anywhere.
Sure.
So the thing is, you can't really I kept thinking, I got to get all my ducks in a row. Everything has to be set up perfectly before I can do this. And that really wasn't the case at all. You have to start a little by little because there were so many different things that I tried. Locums, I did like telemedicine. I did some different like veteran exams, disability exams, and so many different things that I tried to see what worked well for me.
Sure.
Because my other non-negotiable became I want to only work part-time. And so, and as my son's getting older, I wanted to be able to spend more time with him too.
Sure.
So things kind of evolved and changed into, what it is that I needed and wanted now for my life. So taking a little step at a time is actually a lot easier and feels safer.
Yes.
Instead of taking one big jump or leap.
Right.
But if you do little steps at a time, it also helps you build the courage along the way that you can actually do it.
It does, doesn't it? Exactly. And you've described, your priorities shifting and changing, which any parent could probably attest to, that you're when they're babies, toddlers, that is a different skill set than maybe when they're older or in school or a little more independent, and your work can kind of change with that. As physicians, and in your former position, it was here. We don't care what's going on in your home life.
Yeah.
This is your boxed, preset career. This is your schedule. This is your inbox. This is your patient load, without any room for variability or accommodation for what's most important, which is often who's waiting for you at home. So you were able to do that. That's great. So sounds like you've learned a lot. You picked up a lot of skills. You're doing so many more and different things. Has there ever been a point where you regretted leaving full-time clinical medicine or felt like less of a doctor? I know that's people's concern.
Never.
Yeah.
Actually, it was like such a relief because ever since I stepped down from being full-time, I actually enjoy being a doctor a lot more. In the way that I did when I first wanted to go into medicine. Like, you're so excited to go see your patients. I mean, you're still kind of nervous and stuff when you're learning, but you're really excited and you have all that energy and desire to go, see patients and take care of them. And after you've done that for so long, 15, 16 years, it really kind of drains you. And so when you don't get kind of those breaks to rejuvenate yourself and do other things that make you happy and make you feel fulfilled, then it's difficult for you to really enjoy it. So now that I can be part-time and then practice medicine the way that I want to do it on my schedule, it makes me so much happier. I actually don't dread going in. On Sundays, I used to have the dread. I don't want to go into, work on Monday. And I'm like, no, I'm excited to go in, see the patients, see how they're doing. So it's actually great because it's helped me get back what I used to feel for medicine. And I felt like I had lost because I was burnt out.
Right. As so many of us are. Okay. Please tell us, what are you doing now?
So I'm currently working part-time. So I'm still doing a really nice locums job, which is essentially I work 10 days a week, Monday through Friday, 6 to 2 hours, as I mentioned earlier, which is great. No in-basket, no working from home. There's no call. So that's great.
Did you say 10 days a month?
10 days a month.
10 days a month. Okay.
10 days a month.
Great.
Yeah, because it's every other week.
Oh, I see.
So,
I see.
So sometimes there's a couple little extra days in there based on the month, but it's really nice. And so on my weeks off, I get to spend a lot of time with my family and with my son and kind of check out other things. And so one of the other things that you talk about in the course too is aesthetics, so medical aesthetics. And I did take a course, I want to say it was like early, maybe at the end of 2021, and on like some Botox, fillers, those kinds of things. But then more recently, I've been getting into it again.
Okay.
So I actually am collaborating with a nurse practitioner up north. So I'm her medical director,
Great.
and so she has a really thriving med spa up there. And so I've started now working on having my own med spa
Okay.
business. And so we'll see how it goes. But I'm actually here in my suite that I'm renting
It
out.
is
And
beautiful.
oh, thank you. And so we'll see how it goes, but it's really exciting. I'm starting with, doing like Botox fillers and then just looking into so many other things. I think
Sure.
that's one of the great things about, you know, your course and just meeting you
Mm-hmm.
and just knowing that you can open up to different things.
Mm.
If you keep your eyes open and
Mm-hmm.
try different things, you'll find all sorts of things that you can be interested in. And so
That's right.
now I'm going to be looking into like lasers and like microneedling, PRP, things like that. So many different things that we can do to like rejuvenate ourselves and our skin.
That's
And
right.
as we're getting older,
Sure. Sure.
I've become more interested in that too.
Uh-huh. Okay. That is,
So
thank you for sharing. You still do clinical medicine, so you're still, practicing that way, but yet at the same time you're exploring new things. I
yes.
think you've described that part in a great way that we can the exploration part, which is so intimidating to so many of us. The thought of, as I said, I said before in the last segment, trying, it can be such a scary word for a physician. Explore. I mean, it sounds like, wait, you don't know what's coming. That's what both of those words imply. And as a result, we may stay in unhappy or unfulfilling jobs or jobs where we're burning out. But I really I really like the part where you heard, I taught about aesthetics 3 years ago, and it wasn't the right time necessarily.
Yeah.
It wasn't, something you launched right in and, took the course and said, now I'm opening a med spa, or now I'm being a medical
Mhm.
director. You had your own path. You did telemedicine, you did locums, you took time off, you spent time with your family, and then, sometime later you circled back, and now it seems like a better time, the right time, because there
Yeah.
are no rules to this and there's no time limit, only the limit, you impose on yourself or when it seems right for you and your family. That's great. That's great. Okay, as we wrap, I'm going to end with my closing question. Did this version of your career happen on its own? Did it fall into your lap, or did you have to take some action in order to make it happen?
So absolutely not. I had to take lots of action
Okay.
for it to happen as we've described, and you had a
Hmm.
lot to do with that. So I really appreciate it. And I want to
Sure.
thank you for that. And then now as I'm kind of going into this new phase, this like entrepreneurship and trying all these new things, I I'm trying to remember that it takes a lot of work to try something new and start something new and accomplish
Yeah.
something.
Right.
And so that's really important as well.
Yeah, it is. It is. But you're doing it. You've done it. You have all the tools. And, I don't think I need to ask the question, but a lot of physicians equate entrepreneurship with getting an MBA, which
Uh,
if you've heard my talkings on that for some time, uh, I do you have an MBA, Dr. Khan?
no, I do
Are you
not.
new to that? And
But I do have a great appreciation for business owners.
that's right.
I mean, just everything that I've been, slowly trying to build myself,
Sure.
it's a lot of work.
It is work.
So,
It is work.
yeah.
It is work. But I can see, your creativity. Some conversations we've had. You're using a whole new part of your brain that,
Hmm.
and your energy in your body that probably you weren't using prior. That was dormant, but it was still there. It was always there. Um, do you have any questions for me?
Yes, actually, because just like I've been trying out different things. I always wonder what you're up to because I know you're always trying new things, and I wonder what you're up to currently.
Okay, thank you. Great. Thanks for asking. Let's see. Well, I am currently at I'll say a formerly locums gig. As I talk to more and more physicians, I did locums for 5 years, almost 5 years, and in the past year, I've transitioned to an independent contract, which is, I'd say, the advanced portion. That's kind of the advanced section of the course that I teach now. But I do think starting with locums is so important for so many physicians who are just leaving. But you are going through agencies. But I do think it's a great step. It's negotiable. It's flexible. You're talking to recruiters and you're getting good at it. So I was a big fan. But after a number of years, I've switched to an independent contract. So that is one thing I do. I still personally do aesthetics. I am also a medical director as well. I was doing a lot of veteran disability. I've phased that out for now. I was doing some teaching and mentorship around there. Also, that was a great time. I'm doing a lot of expert witness work now that I'm thinking about it. I have 2 cases kind of going, but they're mostly medical writing cases. So I'm doing a lot of reading and writing, talking to lawyers, invoicing for my time and services, which is excellent. And I'm also in the process of re-recording the Doctoring Differently course. In the past year, since it's become fully digital and automated, I've learned so much. I went on a cruise to Antarctica and found out there's a whole, I don't want to say underworld, but I can't think of another world because the ship hospital is definitely below sea level. But there's a whole world of cruise ship doctors and that kind of tourism travel that is so, so fascinating. So I'm going to include that and some other new modules, new lessons, new things I've learned. But it's just, as you know, I love this. It's so exciting. It doesn't end. I'm doing more and more public speaking and just trying to expand my reach to as many physicians as I can, including through this podcast. So thank you for coming on today and asking such great questions.
Thank you so much for all your support and wisdom.
You're so welcome.